Hi, I'm Jeff with Dakota Pharmacy, and today we'll be talking about creatine. You're seeing a lot about creatine on social media, especially lately. Part of that reason is because creatine is really becoming popular in the use of many different things. One of the big things creatine was initially used for was in bodybuilding, muscle growth, and creatine helps your body increase its explosive power or its ability to regenerate energy. Through a chemical reaction in ATP, which is your primary short energy source in your body. The simplest form of creatine that we have available is creatine monohydrate. We have a couple of different brands. One is Thorne and one is Nutridyne. Both of these are creatine monohydrate. When you're looking for a creatine, you really don't need to look for proprietary blend of creatine or a specific brand name of creatine. As long as you're getting creatine monohydrate from a good reputable source such as Nutridyne or Thorne, your creatine is going to be great. I tend to avoid any proprietary blends of this, that, and the other thing because we really truly don't know how much creatine is in that product. Where with like these products here, each 5-gram scoop contains 5 grams of creatine monohydrate, which is a very common dose. In fact, most people should generally take 5 grams of creatine a day. That helps saturate the muscles. With creatine, it does take at about a 5-gram a day dose. It does take about 3 weeks for the muscles to become fully saturated. Now, why supplement with creatine? That's a good question because your body does produce enough creatine every day for its basic function, which generally is about 2 to 3 grams a day. And we do get creatine through dietary sources also. But with higher demands of energy, higher activity levels, we burn through that creatine depletion a lot faster than we normally would. So by supplementing with creatine, we are making sure that our body has enough creatine to work through those, whether it be workouts, whether it be just daily life, stuff like that. The other thing we're really seeing creatine move to the forefront is in brain health. A lot of research is being done with creatine's use in brain health. I just read an article the other day about creatine use in treatment-resistant depression. However, the study was very small. To make a broad statement saying that creatine is good for treatment-resistant depression is a little too early at this point, but I think the outcomes were favorable, and I think it's something you can definitely look to in the future. The other big thing we're seeing creatine used is just overall brain health, attention, just reducing some brain fog, stuff like that. We do see those tend to be a little bit higher doses, just making sure the creatine crosses the blood-brain barrier. And we see those doses anywhere from 10 to 20 grams a day. Now, anytime you want to be using creatine, one of the big side effects of it is you can gain what they call a little bit of fluid retention, or you retain a little bit of water. It's not like you're retaining water in your ankles or in your abdomen or anything like that. It's more that you're keeping your muscles more hydrated. So yes, you do retain a little bit of water, not enough to really, I think, make any type of difference. I think what it really is just that your muscles are staying much more hydrated. A hydrated muscle performs much better. They look fuller, look bigger. So as far as the water retention associated with creatine, I think that's not really a big concern. Another concern with creatine we hear about is GI upset. Again, if that's a concern for you, maybe titrate your creatine up slowly, do a half a scoop a day for a while, a full scoop a day for a while, and just see how that tolerates it. I've never had a problem. I take creatine every day. I never had a problem with getting GI upset, never even noticed it, but it is something that we warn people of. The other thing we want to make sure if you're using creatine is make sure you have good kidney function. If there's any issues with your kidney function or any concerns, you always want to discuss that with your provider. And then the other thing is anytime you go in for a lab test, you always want to make sure your provider knows that you're using creatine. I use creatine every morning. I use about 5 grams. I don't superload it. I don't take any more than that. I use about 5 grams. I actually use the Thorne brand. As far as either one of these, I think they're both great. Doesn't really matter. I just happen to be using the Thorn one. I pair mine with LMNT, which is a electrolyte drink. It's just like a salt. It's got magnesium, sodium, potassium in it, and I just throw one of those in with water with a scoop of creatine, and that's my morning kind of routine. Creatine, the ones that we carry have no flavor whatsoever. Another really good thing you can pair creatine with, that I sometimes do, is I pair it with Thorn essential amino acids. That's another good thing to do if I'm using creatine multiple times a day. Doesn't happen very often, but there is times. The other thing about creatine, if you're thinking about using a supplement, overall cost for creatine per day is relatively inexpensive. We're talking this here 90-day supply, $45. So it's 50 cents a day. I mean, as far as supplements go, this is one of the most cost-effective to benefit ratio you're going to find. The other thing is creatine has been studied and used for upward close to 50 years, and we've seen just huge benefits with it. So dollar for dollar, you really can't beat creatine as a supplement. If you have any other questions or you want to come down and discuss it, come on down and see us here at Dakota Pharmacy. We'd be happy to help you.